Breaking news out of Central Africa. The Democratic Republic of Congo has confirmed new cases of Ebola in September 2025. Health officials are racing against time to contain the outbreak. What does this mean for Africa, for global health, and yes, for us here in the United States? Let's break it down. The DRC's Ministry of Health has declared an outbreak in specific province, usually Equateur or North Kivu in past outbreaks. At least X confirmed cases and X deaths reported so far. Insert current numbers once confirmed. Ebola is a viral hemorrhagic fever with a fatality rate that can reach 50–70% without effective treatment. The virus spreads through direct contact with blood and bodily fluids, not through the air like flu or COVID. While Ebola is highly deadly, it doesn't spread as easily as a respiratory virus. But when outbreaks happen in remote regions with limited healthcare infrastructure, they can escalate quickly. The DRC has experienced more than a dozen Ebola outbreaks since the virus was first identified in 1976. Dense forests and frequent contact with wildlife, like fruit bats, a suspected reservoir, make spillover events more likely. Conflict and limited healthcare resources make rapid containment difficult. This isn't the first time the DRC has battled Ebola, but each outbreak carries the risk of spreading beyond borders. The World Health Organization, WHO, has already deployed emergency teams. The U.S. Centers for Disease Control, CDC, is monitoring the situation closely. Vaccines exist. The RSV-Zika vaccine has proven effective in previous outbreaks. Treatments like monoclonal antibodies have dramatically improved survival rates when administered early. Unlike the catastrophic 2014 West Africa outbreak, the world now has tools, vaccines, treatments, and stronger monitoring systems to prevent Ebola from spiraling out of control. The risk to the U.S. public is very low. After lessons learned in 2014, airports have enhanced screening protocols for passengers arriving from outbreak zones. Hospitals nationwide now have isolation units and trained staff ready to respond. In other words, Americans don't need to panic, but staying informed is crucial. Outbreaks highlight global inequality in healthcare. Diseases don't respect borders. Supporting outbreak response abroad protects everyone. Rapid funding and international cooperation are key to preventing another 2014-style epidemic. Helping Congo contain Ebola isn't just humanitarian, it's an investment in global health security, and in protecting ourselves. Ebola is one of the deadliest viruses known to humanity, but with science, global cooperation, and vigilance, we can stop it in its tracks. Stay tuned, stay informed, and remember, when it comes to outbreaks, knowledge is the best defense.